So I mentioned earlier that I had been in the Senate when we passed the Affordable Care Act. And not only was I in it, but I was the most vulnerable Democrat up for election of any Democrat that was up for election in 2010. Maybe I should have said a word about that, by the way. I was appointed to begin with. I got elected in 10 under horrible circumstances because it was the rise of the Tea Party.
The Tea Party.
Exactly. Thank you for remembering. My mom doesn't even remember it, and I remember. I still bear the scars of that. And then I actually got reelected in 16, which was supposed to be an easier year, but that was the year of Trump. You remember it turned out not to be an easier year. But, and as I said earlier, I went out, voted for the bill, and then went out and had town hall after town hall in rural parts of the state. Back then, I led the fight on the public option because I believed that that the Affordable Care Act would be incomplete without it. And in fact, that's turned out to be true because there are millions and millions of Americans who make too much money to be eligible for Medicaid, but not enough money to comfortably afford private insurance. And I believe they should have this alternative. And my plan is called Medicare X. Bernie says about the single payer, I wrote the damn bill. When it comes to Medicare, the public option, I wrote the damn bill. There are a lot of other people running on the public option in this race. None of them has written the legislation. Mine's called Medicare X. I was proud to have Tim Kaine from Virginia as my original co-sponsor on the bill. He ran on this bill in Virginia. The virtues of the bill are that first of all, it starts in rural areas because I wanted to say to rural communities, I'm listening to you, and while we may not be in alignment politically all the time, I know that you have a particular problem because there are many places in America with one or less insured, and those are rural, tend to be rural. Starts there. Over 3 years, it becomes available to everybody else. It is a plan administered by Medicare. It's not actually Medicare because that has its own set of issues because we're now spending $3 for every dollar we're collecting on Medicare, and I think there are a lot of people that have spent their lives earning into Medicare who are, when they're faced with the prospect of having other people in Medicare, are going to say, that doesn't sound like a great idea to me. It gives the choice to everybody in America whether they want to stay on their private insurance if they have it or go on the public option if that's what they want. And they can pay a premium that will be up to like 12% of their income. Most people will pay much less than that to be on the public option. And I think you're done. In 3 years, if you auto-enroll everybody who's eligible for Medicaid and everybody who's eligible, every kid who's eligible for CHIP, and have a public option, everybody in America's covered. Now, we still have massive problems with healthcare costs, which we're not even debating in this Democratic primary of ours, but that is what's really killing people in this country. I mean, and people are having to make choices between food and drugs and all of that, and that's something that we still have to grapple with. And my bill does, because it requires the federal government to negotiate drug prices for on behalf of the American people. We also have to create much more transparency in our healthcare system because there's no way for anybody to know what anything actually costs. It's impossible. If you're lucky, at the end of the day, after you finish fighting with your insurance company, maybe you can figure out what you were charged, but not what it actually cost. And the variation of everything from knee replacements to colonoscopies to, anything you can think of is crazy, and that's all that means is cost and profit for places where we're not necessarily one profit. So basically, that's what I think. I really think Medicare for all is a bad idea. I think it's a bad idea because 85% of the American people already have health insurance. I think it's a bad idea because it takes away 22 million people's insurance who have Medicare Advantage in this country and who love Medicare Advantage. It cancels every single union's healthcare plan in America, and it raises taxes on the American people by about, or at least, $31 trillion. And those aren't Republican talking points, as Elizabeth sometimes says. Those are Bernie's talking points. Bernie has been very clear, and it's in the bill. It's not like there's a mystery. I mean, it's written down in legislative language. It makes illegal all insurance except for cosmetic insurance and says to the American people, for the privilege of losing the choice of buying private insurance if you want it, we're gonna put a $31 trillion tax on you, which is the equivalent of 70% of all the tax that the federal government's gonna collect over the next 10 years. That's not gonna work. And I say this not as a moderate, but as a progressive Democrat. I do not want to spend the next 10 years fighting a losing battle on Medicare for all. That's not what I want to do. That's not going to help the kids that I work for in the Denver public schools. It's not. It's not going to help their families. Passing the American Family Act and reducing childhood poverty by 40%, that would help. Making sure we had universal preschool in this country, that would help. Fighting to make sure that Social Security and Medicare are protected, that would help. Dealing with climate change, that would help. And we're not going to have the chance to do any of that if what we've signed up to is for Medicare for all. Elizabeth says, well, you know, basically, if you're not for big ideas, go home. I'm for smart ideas, you know? And by the way, some of mine, I think that I have as ambitious an agenda as anybody in this race, but it's a different agenda. It comes from the perspective of somebody who knows what it takes to win in purple states. And that's not, I don't think that makes me a sellout. I think that makes me somebody who wants to send Mitch McConnell back to Kentucky, which I do. And make Donald Trump a one-term president, which I do. And that agenda is in our grasp if we can nominate somebody in this contest who actually is more concerned with meeting people where they actually are than, you know, what the social media says we should be doing, or what raises money on Twitter, or what, you know, creates the most attention. And you're discovering at this moment why, in some ways, I'm not the most successful politician in this field, but I intend to be. But it's harder to try to do it the way that I'm trying to do it, but I'm trying to live up to what my daughter said to me at the beginning of this election, which was, this is my oldest daughter. My youngest daughter, when I asked them whether I should run for president or not, my 15-year-old said immediately, you gotta run, you need to run. And I thought, that's amazing that she thinks America needs my leadership that badly. And then we had another couple more paragraphs of conversation, and she said, and it became clear that she just saw it as this awesome way to get me out of the house during her 15th year. But in fact, she may be burning it down right now as we speak. But my 20-year-old said to me, Dad, if you run and you tell the truth and you lose, no one can fault you for it. And I said to her, Caroline, that's good, because there really is no other reason for me to run. And there's no other way for me to win. And maybe there's not a market for the truth, but I actually think after this guy's been in the White House, we could do a lot worse than have somebody in there who's not going to lie to the American people, even when it's hard. We need to restore integrity to that office. And I was pleased about 2 months ago when the Des Moines Register, which is the largest newspaper in Iowa, ran an editorial after I'd met with the editorial board there. They met with all the candidates, and the one after I met with them came out and said, Michael Bennet pounds truth into this campaign. In the end of it, they said, you know, even if you've committed to another candidate, give this guy another look, because he seems to have a diagnosis about what's really wrong and how to overcome it. And if nothing else, I was able to send that editorial to Caroline Bennet and show that I kept my promise to her, and that's why I'm keeping my promise to you tonight. Yes.